The WHO guideline on social distancing was practically flung out of the window on the first day of business in Lagos as the COVID-19 lockdown relaxation commenced. Desperate commuters and patrons of banks, shopping malls, and other public places around the metropolis were clearly preoccupied by some other thoughts far from social distancing, as they scrambled to access services which they had been deprived of since the lockdown came into effect. On the evidence of how the first day passed off, could it be said that the decision to lower the barricades at this time was well thought through? Could there be medical implications? Has all the hard work been undone? Well, we're now going to explore these questions and others by speaking with Dr. Saliu Oseni, a consultant general surgeon and chairman, Nigerian Medical Association Lagos State Chapter. Good morning, Dr. Oseni, and thank you for joining us on the morning show.
Good morning, Doctor. Thanks for joining us.
Good morning. Thank you for having me.
Good morning. Thank you very much indeed. Well, Dr. Oseni, yesterday was the first day of the relaxation of the lockdown in Lagos and the Federal Capital Territory and other parts of the country as well. But we have heard that people did not observe social distancing. Guidelines were not followed even by business owners and corporate organizations. Do you think that government should have tarried a while to study the situation better before relaxing the lockdown, considering the fact also that the numbers on the daily basis of confirmed cases of COVID-19 seem to just be growing, whereas in other parts of the world, what they do is that they allow the curve to flatten first, at least a little bit, before they even contemplate relaxing the lockdown. What do you think?
Well, thank you very much. Just like you said earlier in your review, NMA has actually stated clearly that the relief of the lockdown is premature, and we feel that we are actually yet to really reach the peak of the pandemic in Nigeria, I mean Lagos particularly. So relieving the lockdown at this time was quite premature, and I mean, what happened yesterday is not unexpected. We have a congested state like Lagos, where you have over 20 million people, with majority living in face me, in areas that are congested, areas that is even difficult. Even if you really have in your mind that you want to have the social distancing, it's difficult to implement. That is the reality that's on ground. I passed through some markets yesterday and realized that most of the people that are selling market are not wearing masks. A few of the people around, maybe commuters and other customers, are wearing masks. Maybe sort of 40% compliance. This is not good enough, because the truth of the matter is that when you have an infected person with COVID-19, recycle the infection 10 times, you would have succeeded in infecting about 3,500 people. So if you are not careful, we may end up with a terrible exponential increase. And that is why recently what we have been doing is to appeal to the public to try as much as possible within their ability to keep to the guideline of the NCDC.
Doctor, thank you. Now, with this easing of the lockdown and the low compliance, what do you foresee over the next few weeks with regards to the COVID-19 situation in Nigeria? You stated clearly that you believe we have not reached our peak yet. So how do you see us reacting to this lockdown, well, easing of the lockdown in terms of COVID-19?
Well, the reality is that the likely consequence is better imagined. And I think it's just for us to pray that God, that has been giving us the mercy to be this lucky thus far, will still give us that chance. Just like you said earlier too, we still have a lot of backlog of tests that's not been done, which means that we may actually have a lot of people infected that are still within the community. And with the lockdown, it also allows for a lot of people to go to the hospital, which means that the hospital spread may also increase. And like you are aware too, we already have quite a number of health care workers infected. So the reality is that it's a very complex situation that all we can just do is just hope on God, just like the Italian president, prime minister said the last time. So the reality is we should, as much as possible, try to play within, obey the required guideline from NCDC. Like we all know, the rate at which you tend to touch your face is quite significant. That you can see that I did just now, even though I'm careful about it, because I'm not going through my nose. But that will happen to a lot of people unconsciously, because you have an environment whereby you may not really be able to be too conscious of those. But over time, a lot of people are getting to build that confidence, so awareness to avoid touching their face. That is why one of the most important game player here is regular hand washing and application of hand sanitizer. Where you have a situation where you don't have those two available, make sure you don't touch your face, because the real entrance into the body is through the nose, the mouth, and the eye. So in reality, we need to create more awareness. Most of the masks that people are wearing now are not surgical masks, neither is it N95. We have a cloth mask, and there is no assurance that the cloth mask is quite protective. Yes, it can actually reduce the amount of the virus that is disseminated to the environment, but however, may not necessarily protect the other person that is receiving the disseminated virus. So in reality, we have a danger in our hand, but just like God has been merciful to us that we have refused to reach the critical line, maybe we may just be that lucky. But in reality, I think that government could have done better. It is not enough for the federal government to leave the state government to actualize palliatives. If the government had come towards assistance of the states with respect to the palliative, because in this state, the government has really tried, even though they could have done better, just like I said. There are a few things that are part of the plan that have been changed, and we think that going away or deviating from those agreed arrangements may actually have their own consequences. So it is important that we continue to create more awareness among the citizens so that they abide by the guideline of the NCDC.
Well, yes, I agree with you absolutely, Dr. Oseni. But let's talk about the plight of healthcare workers. A few days ago, we were told that the number of health workers that have been infected with COVID-19 in the course of their work had increased from 40 to 113. NMA quoted a different figure. NMA was insisting that the figure will be up to about 300. But even since then, there have been reported cases of health workers being at risk and being infected in Katsina State, in Osun State, and also in Lagos State. The Minister of Health, I recall, said health workers themselves should try to be careful, while government will also do its own part of providing protective equipment and also providing insurance. And some states have announced very generous health insurance for health workers. But what is the mood within the medical community about protection for frontline health workers?
Well, the reality is that the number the minister has quoted cannot be right, putting into consideration the number that we are aware of, even though we have some institutions that are not really coming up to reveal the number of infected healthcare workers within their institution. But as the association, we are also aware. So we don't know how the minister got his figure, but obviously the current number is much more than even the 300 that NMA has mentioned. Yes, it's enough for the minister to say the healthcare workers should be careful. Or how careful can you when you don't have the protective gear and you have to attend to the patient? Because the reality is that if you now say we are not attending to the patient, they will say the healthcare providers are on strike and they are not applying their calling. But the truth of the matter is that even our pledge has stated that we should take care of our health before every other person so that we can take care of other people. For every health worker that is infected, the chances is that he or she will infect as much as 50 to 100 people. That is the reality on ground. And for every health worker that is taken off the circulation because they have to go into quarantine or isolation, it means that over 6,000 citizens are suffering from receiving health care. So it's important that government should actually play its role. The government has not been up to its task when it comes to providing protective equipment. We have suggested to government, especially with respect to the private hospitals, because most patients will go to the private hospital before going to public hospital, or end up in the private hospital if they are refused in the public hospital. And these private hospitals are only limited by the resources that they have. So, for instance, a disposable latest glove used to be about 1,000 naira. Now it's about 4,000 to 5,000 naira. A surgical mask used to be about 250 naira. Today is about 7,500 to 9,000 naira. So if you have to apply this to yourself and to every patient that comes to your hospital, it becomes a big burden. So we have suggested to government to acquire these materials or produce it en masse, if they can talk to any company that can produce it in Nigeria, and make it available to all hospitals, not only public hospitals. So the reality is that even in the public hospital, we don't have enough protective cares. And when you now talk of even the frontliner, that is why it's been redefined severally. Because the people in the isolation center, yes, they are frontliner, but they are aware of the fact that they are attending to patients that are suspected or infected. But the people at the public hospitals or private hospitals attend to everybody without that suspicion, even though we have told them now that every patient should be seen as a possible COVID-19 infected patient. So in reality, it's a complex situation. I mean, like you're showing now, you see in the bus stop, how will you organize people not to rush at the bus? Especially with the fact that you are now saying the buses should not be full. But you will still have people rush. So part of what can be done is for government to distribute enough hand sanitizer, especially to the transporters, so that when you have your passenger in the car, you give them hand sanitizer. When they are going out, you give them hand sanitizer. But if you want the transporters to provide this on their own, it increases their overhead costs, and that will not be obeyed. So government needs to live up to its responsibility. The last time we were talking about palliative, the lockdown 3 states, and palliative were being shared in areas where there's no lockdown. The essence of the palliative was for those that are not going to work. So if you continue to apply this type of politics, we probably may end up with a disaster in our hands.
Thank you, Doctor. You mentioned something that is quite dark, which is that for every healthcare worker that goes into isolation or quarantine, 6,000 Nigerians suffer. That is quite a dark situation to look at. Doctor, let's take a closer look at KANO State and the situation that is going on there. Now, the presidential task force that was led, I believe, by Dr. Nasiru Gwarzo in KANO State have come back with their report recently and believe that 80% of the tested cases were linked to COVID-19 in the state. Now, we also understand that KANO State is currently on a federal lockdown for the next 2 weeks, even though the governor himself has been in some denial and has proposed to ease lockdowns for yesterday and today for 6 hours a day. How do you react to what is going on in KANO State, and what is your analysis of the situation?
Well, the reality is that the public health workers need to go to work. Federal government needs to support the doctors in KANO State. KANO State has a total population of about 1,500 doctors. With that population, the healthcare providers are likely going to be overwhelmed. And you have an environment where it's already said by the KANO State NMA chairman that a lot of the people in that area does not even believe that there's COVID-19. For us to enlighten the public, we need to talk to the community leaders, to the imams, to the kings, so that they can pass the message across to their people. Because these are the people that the local people actually obey and listen to. So, but if federal government is going to leave the responsibility completely to the governor of the state, He can only offer as much as he can with the resources that he has. So it's important for us to see this thing as a big, dangerous disaster in our hand. Federal government cannot operate separately from the state. They need to work together, because for every state that there's a federal institution, the citizens are still the citizens of that state. So government needs to liaise together. We don't have to have, this is federal government, this is state government. For instance, the benefit that are given to the doctors by the federal government is meant for those in the federal institutions. But the truth of the matter is that the people that are most involved in this management are the people that work with the state institutions. I'm not saying that those in the federal institutions are not. For instance, LUTH has an isolation center, and they are working. But the reality is that government, state, and federal need to bring resources together and apply it at the same time. And that is what needs to happen in KANO State. Because, one, to start with, it's been proven to some extent that some of the deaths that have been announced are linked to COVID-19. And if that is true, that means we have a massive infection in KANO State. And we need to quickly do public enlightenment and allow the public health workers to go into work. But the reality is that we have politicized this COVID-19 thing so much that is why we are where we are now. I mean, just recently, the Lagos State Governor agreed that the delay in the lockdown of the port of entrance, airport, seaport, and borders is part of what has created this problem. At our first release in Lagos, that was what we suggested. And we advised that hotels should be acquired around the airport so that whoever is coming in will lodge in it there for 14 days before they are allowed to come into public. But a lot of politicians have their relations out of the country, and they believe that they should come in before the lockdown is on. And that was what created the problem. So we need a lot of advocacy in KANO State. Then the healthcare providers need to be encouraged. There's not enough incentive to encourage people to go on. I mean, if I'm going to put my life at risk, what happens to my family if something goes wrong? If a doctor is taken out of circulation for 14 days, who make the alternative provision for those days for extra income that is supposed to have, apart from being employed with government? So a lot of these people don't even have insurance. The insurance that have been flying around, we are yet to really have the detail of what that insurance is. The insurance the federal government is providing is for who? Is it only for federal employed doctors, or is it for every doctor that is involved in management of COVID-19? The one that have been donated by the insurance companies is what a lot of the governors have been flagging around. We don't think that is good enough. Resources are available in the state. And even if government is not going to attach insurance to individuals at now, they can provide, okay, we have 2,000 insurance that is available. And they have an arrangement with the insurance company so that anybody that is infected and has so morbidity or mortality will benefit from that. So everybody that is healthcare provider will know that I have an insurance, what this value and all this stuff for me staying there. So it's not as if you now have to insure everybody that is there, but you have an insurance that is paid for, and you have an agreement with that insurance company so that whoever have a need for that insurance, we have insurance. But the truth of the matter is that there's nothing stopping our government from insuring everybody, every healthcare provider in the state. And that is a responsibility that the federal government should actually take on itself. So that, I mean, you know, we hear of what is happening outside Nigeria. America had to pay as much as $1,200 to each parent as palliative for them to stay back home.
Well,
they
Dr.
provide
Oseni,
enough insurance for their healthcare workers. Yes.
Dr. Oseni, I think the point about the plight of healthcare workers is well made, but there is something I will need you to help us clarify. Yesterday at the media briefing of the Presidential Task Force on COVID-19, the Minister of Health, Osagie Ehanire, who is your colleague, said that it is unethical for healthcare facilities to refuse to help patients seeking help, especially during emergencies. And there have indeed been reports that some medical facilities, even general hospitals and private hospitals, tend to reject persons out of mere suspicion that such persons may be COVID-19 patients? Is this out of desperation or fear, or is it a form of protest that this is the case?
No, that cannot be right, because as it stands today, even in Lagos, what we did at the onset of this pandemic was to ask every affiliate, as every institution, to create a protocol to attend to their patients. So what we encouraged was, once we have a suspicion of COVID-19, you refer the patient to where they will be tested. It would have been easier if every institution, like every general hospital, every federal institution, have means to test the patient. If you have a patient that is suspicious, like where I work, we have an isolation center. And that is what we are encouraged for all the general hospitals. And most general hospitals have those isolation centers. So what's probably has been happening is that when you have a patient that is suspicious, doctors attend to them and ask them to go and run their tests. Unfortunately, the tests are not, kits are not being available. We have a situation where a patient was sent for a test who has some symptom, and they asked the patient to come the following week. Of course, it's either the patient is dead by following week or the patient had recovered by the following week. So you cannot ask a suspected patient to come back for a test a week later. Government should accept their wrongs. They should stop blaming healthcare providers. The healthcare providers are risking their life. We have quite a good number of them that are infected. That's why that we still continue to run. But we have insisted that doctors should continue to attend to emergency. And that is being done. I've seen a lot of emergency in my unit. We've attended to a lot of pregnant women that has emergency in my unit. And that has been happening all over the place. But the thing is, we will not encourage that people should attend to suspected patients without proper protection. And in this situation where we have a community spread, you have to suspect everybody. So if you don't have protective equipment, then you won't attend. So, but if you have the suspicion, the reality is that the patient has to go to where the patient will be tested. You cannot just hold on the patient that you are suspecting to have COVID-19 when you cannot test the patient to confirm the diagnosis, and you cannot manage the patient in that institution. So the reality is government needs to do what they need to do. Test kits are scarce, protective equipment are scarce, and why are you not blaming the healthcare provider for that? We have the right to suspect. I mean, if one of the patients that was suspected in my unit came in, no hypertensive, no diabetic, and the doctor has high suspicion, doctor referred the patient to IDH. Patient decided to go to a private hospital and came back in the night. But that's why that they still accepted the patient, admitted the patient, put the patient in the isolation room because we're already late, and we are worried that the patient may go to another hospital and increase the spread. But of course, the patient is public. It would have spread the thing. The patient would have passed on in the community, and we will not be able to trace it. So that is the reality. So when there is equipment, patients are being attended to. But when you have a suspicion of such a patient has to go to where they will be diagnosed. Not, you don't hold on to a patient that you cannot render assistance.
Dr. Oseni, thank you for that clarification. Now, I'd like to go back to a point that you raised at the start of this conversation. You said that, in your opinion, the lockdown was certainly premature. And, of course, a lot of people would also agree with you on that, while others may differ on their opinions. Now, unfortunately, Nigeria is a country that is coupled with several issues. There is multidimensional poverty, and really and truly, you're only as strong as your healthcare system is. Now, some believe that the approach that we have adopted by easing the lockdown over the next 6 weeks is silently a survival of the fittest approach, whereby government is going to get to the point where healthcare systems are overwhelmed, and whoever survives coronavirus survives and whoever doesn't. Is that a situation that you foresee?
Well, just like I said earlier, what we can do now is to appeal to the citizen. Because for me, yes, especially Lagos State government have tried, but I don't see the synergy in the work between the state government and the federal government, because I expected that the federal government should be seen supporting massively the effort of the state government. But the reality is that I want to believe that government has failed then it is now left for us to decide whether we want to survive.
Well, on that note,
if we truly want to survive.
On that note, thank you very much, Dr. Oseni, Chairman, Lagos State Chapter of the Nigerian Medical Association. Thank you very much.